So as mentioned, my name is John Stevenson. I'll be presenting my case study. For the introduction, so endometrial cancer is one of the most common gynecological malignancies in the United States, primarily affecting postmenopausal women. As we know, risk factors include nulliparity, early menarche, late menopause, polycystic ovarian syndrome, diabetes mellitus, unopposed estrogen replacement, and a history of breast cancer or tamoxifen treatment. Endometrial cancer commonly metastasizes to the pelvic or para-aortic lymph nodes and infrequently to the liver and lung and bone. Sorry. Brain metastases occur rarely in maybe 1.16% of cases. And commonly presenting symptoms of brain metastases are headache, focal weakness, and aphasia. UTI and GERD populations and DKA are also associated with altered mental status. When it comes to the case presentation, it starts with a 72-year-old female, a 72-year-old female with a history of diabetes, hypertension, hyperlipidemia, peripheral neuropathy, rheumatoid arthritis, chronic kidney disease stage 3, who presented with altered mental status and a blood glucose level greater than 500. Per the caregiver, the patient had 6 months of frequent falls and increasing forgetfulness. When it came to the workup, the labs revealed an anion gap metabolic acidosis with a negative drug screen. The urinalysis suggested a UTI, and a propionate treatment was initiated for the DKA and the UTI. CT of the head and cervical spine revealed areas of cerebral edema within the left parietal lobe, suspicious for metastatic lesions, and the chest X-ray showed a retrocardiac consolidation, suspicious for pneumonia. MRI of the brain and CT chest MRI of the brain and CT chest revealed multiple pulmonary nodules in the bilateral upper lobes concerning for metastatic disease, and the CT abdomen/pelvis was suggestive of a uterine malignancy. A CT guided biopsy of the right lung confirmed a diagnosis of non-small cell carcinoma, and the lung nodule was suspected to be of endometrial origin with metastasis to the lungs and the brain. Additionally, the patient was noted to have intermittent right-sided motor deficits and aphasia throughout her admission. So when it comes to discussion and conclusion, main thing I wanted to point out was that this case is an unusual presentation of a common gynecological condition. The patient presented with a triad of conditions known to cause altered mental status in the form of DKA, UTI, and metastatic brain lesions of endometrial source. This patient had no known history of malignancy prior to this visit, and although her intermittent focal weakness and aphasia were presumably caused by cerebral edema from the brain metastases, her mental status changes were most likely due to the interplay of all three of these diagnoses. And that's my presentation. Thank you.